You're listening to the Heritage Podcast.
Assalamu alaikum, my name is Ibrah Sheikh. I'm here to do a video podcast with British Muslim Heritage Centre. In fact, I'm a radio presenter on Heritage Radio, and I've been invited to come along. I have a most wonderful guest here, Dr Andleeb Younas, who will be telling us about her expertise and experience in a moment. And we're here to talk about coronavirus, COVID-19, and the impact that it's had on the Black, Asian minority ethnic communities across the whole of the United Kingdom. And I want to be able to ask a few questions and hopefully give information back to our listeners and our viewers as to what the impact of COVID has been, and with the vaccine now being rolled out, I have a fundamental question that I want to ask you, Dr. Younas, and that is, why is it that the BAME community is reluctant to take up the vaccine? So without further ado, Dr. Younas, please allow me to introduce you, and if you could tell us a little bit about your background.
Thank you very much, Ibrah, for inviting me, and assalamu alaikum to everybody. My name is, as Ibrah has told, I'm Dr Andleeb Younas, and I was working as a senior clinical fellow in surgery. And I was always involved in lots of voluntary activities, and a member of APPSUKF Foundation.
What is that from?
This is the organization of all Pakistani physicians and surgeons in United Kingdom. So okay. All Pakistani background and Pakistan, from Pakistani-based community who are doctor and in medicine field, they have this association who are working together for the welfare of people of Pakistani origin in this country, yes, and people of UK as well, and also working back home to serve people in Pakistan.
Mm-hmm. Well, may I call you Dr. Andleeb?
Yeah, why not?
You'll be familiar with FAMS, the financial assistance for medical students?
Yes.
Yeah? Yes. Well, I used to work with Dr. Amir and help raise funds.
That's wonderful.
Yeah.
That's wonderful.
Many years ago, I, fortunately, for the best reasons in the world, my daughter was born 5 years ago, and so she was very young, and so I decided I couldn't juggle doing work, mm-hmm, and supporting the charity, and also being a father to a very young child.
Yeah.
So something had to give, and unfortunately, I gave up on FAMS in terms of the involvement with the fundraising. But it's been going, I'm delighted to say, it's been going from strength to strength without me. Clearly, it was the right thing to do. But I mean, it's a wonderful organisation. I think they must have now come up to about 75 or 77 doctors that they've helped train to qualify.
Yes, and it's still going on, and now a lot of young people are involved as well. So,
yeah, absolutely.
So it's
really a generation that's coming from Pakistan, and now their children, because my nephew is now training to be an orthopedic surgeon, and my niece is a GP here in Birmingham. And so the next generation, it's very important that they maintain the emphasis of giving something back. Something, I call it sadaqah, I call it a blessing, that we can give something back to our community for the next generation.
This is the beauty of any charity work, or we can say any work for humanity, that passion we have to transfer it into our new generation, and this is the only way to carry on good things.
It has to be done, and that's why Dr. Amar, when he set it up, and then the fundraising that's gone on with it. And one thing which I'm very proud to say that I hope I get some credit for it, was that originally they were asking for people to give donations at a charity event like a dinner, and they were asking, can you give 1,000, can you give £5,000, or can you give £10,000? And people found that challenging, and, despite the fact that we're now going through a very difficult economic time. Even in the best of times, that would be challenged. So I came up with the idea that rather than asking people to give money at an event where they're feeling pressurized, why don't we just ask them to sign a direct debit?
Yeah.
And if it's £50 a month, or if it's £100 a month, because £100 a month would contribute towards the cost of getting a student through the medical colleges. There are 5 medical colleges, as I'm sure you're aware, and it would help them get through. So it was a really fantastic idea. And so lots of people signed up for direct debits, including myself, and that just goes out and you don't think about it. But at the same time, the reason why I took it on, this is why I think the question of Sadaqah and why this show is actually being taking place, is that this is voluntary. No one pays myself or the people here, the team here, and I do the radio show every Friday morning, and that's all voluntary as well. And the reason for that is, very simply, that if we don't set the example for our younger generations about giving, about charity, and to give the example of what Sadaqah means through fans, is that if we pay and help a young person who otherwise would not have trained to be a doctor, and once he or she is qualified, and remember, the fans is actually paying for their shoes, their clothes, their books, their pencils, their accommodation, and their studies and their fees. They're paying for everything, and it's usually targeted for people who would not be there, but they have the intellectual prowess, but they don't have the financial prowess. And so, if you pay for somebody, if you can help somebody to achieve that qualifications, and for the next 35, 40, possibly 50 years, they are going to be helping ill people get better, sick people get better. And for me, that's a sadaqah that will long outlive, long after I'm gone. And I think that's the real value of sadaqah and the interpretation of it, and the value to me that hopefully whenever Allah calls me, that I've left something behind that will carry on, and that sadaqah will carry on as well.
I really agree, and there are so many important points you have discussed in one thing. The most important thing is the best thing that you can give to somebody is knowledge. So knowledge is a blessing. So as you telling me that you're doing as a podcast, and you're doing interviews in the morning, every morning, Friday, every morning. And the best thing that any person can give to any other person is the knowledge. And the knowledge is everything. And what we are going to discuss as well, this is also something related to the knowledge of something that you don't know, and then you have obviously doubts about it, then you don't act on it. Other thing is that the most important thing is that what you are doing at that time of collecting, helping in the raising fund for students who are unable to afford the medical education. One person, when you are raising his or her standard, it means that you're going to raise a whole next generation standard. And one person, when you're going to educate, mean you are going to now educate the whole of the generation. So it's not a small thing; it's quite a big thing, and it's a basic thing that if we are start doing it now, and mashallah, it's very important thing that being from Pakistani region, we have such a I think abundant amount of charities. People work there in different charities. There are so many organizations working there. But being a Muslim, we have been obviously told by from our Lord and our Quran, so Iman, that charity expands your money and your knowledge. Anything that you distribute, it multiplies. And this is something, the beauty of our faith, and the beauty of humanity for all those people who have not believe in a religion, but everybody believe in that. Anything you distribute, you share and give to the other people, obviously in return it gives something to you, and obviously on the whole picture it is going to be benefited for whole humanity.
Absolutely. And if I may say so, I know that this may sound like a plug for fans, and I hope if it does, I make no apologies for it. One of the reasons why I chose fans as a charity that I wanted to support was that I've come across many charities, particularly those that are Pakistan-centric, and they have exceptionally high overhead costs. And so whatever you give, a part of it goes for running the charity. And for me, that is, in a sense, getting away from the construct of sadaqah that Allah has given to us, which is you give charity without asking for anything back. And so when I got introduced to fans, they took 0 pennies out of for administration. Everything is done voluntarily, and you know, there's no money taken out. Whatever has been raised goes back to Pakistan to train and help those that need it. And I thought, well, that's the kind of principle that I'm very happy to be associated with. And coming back to the present day and why we're here, Andleeb, which is we're going through a very difficult time, a very difficult crisis, pandemic, which the world has not really seen in our generation or several generations prior. And the information, we live in a totally different world to 1918 when the Spanish flu took place and 50 million people sadly lost their lives.
Yeah.
Now, 25 million people have been infected worldwide with coronavirus. And yesterday we had the horrific news that 103,000 lives have been lost due to COVID-19 just in the United Kingdom since the start of the pandemic. And the sad news is that the Black, Asian, minority ethnic communities represent a very small percentage of the total population, but they represent a very large percentage of the fatalities associated with COVID. And I really want to explore that. And coming back to the construct of Sadhkar, and we're giving up our time here. You're giving up your valuable time. I'm giving up my time, and the team here, and we want to get information across that says why is the fact that the Black, Asian, minority ethnic communities, particularly the Pakistani, particularly the Indian, particularly the Bangladeshi communities, particularly the Afro-Caribbean communities in particular. I don't have the facts for the Chinese or the other ethnic groups, but they've been hit exceptionally hard by COVID-19. And I don't understand why. So I'm going to ask, Doctor, if you have some answers that you may be able to give to us. And then the second part of this podcast is going to address the very real fact that in North Staffordshire, and this is a research done by Shelton and Hanley, Stoke-on-Trent, by Dr. Lenin Velturi, who told GP Online on the 19th of January, so we're about 8 days behind. You may know him or her. But that in the Black, Asian, minority ethnic communities, there was 20 to 30% did not attend DNAs, as opposed to 2 to 3% in other groups. And I want to use this opportunity and a discussion with you, Doctor, to find out what the reasons could be behind those horrific numbers. Not only has the community suffered so adversely with COVID, but I don't understand why the community isn't taking up the vaccine as much as I hoped that it would do, bearing in mind that there's been so many losses associated with COVID. So that's the plan for today. Now, Adam, could you please play the BBC video at this point? Yeah.
If you are Black, Asian, or from a minority ethnic group, you are at a higher risk of dying from COVID-19 than someone who is white. In fact, research shows the risk could be nearly twice as high. But is that because of someone's ethnicity, or are there other reasons? We've been told the virus doesn't discriminate and we're all in this together. But are we really?
What COVID-19 has done is to emphasise the existing health inequalities in the country. We need to address those inequalities, whether they're to do with deprivation or to do with people's background.
In the UK, access to healthcare is free for everyone. Let's look at England because it's the most ethnically diverse nation. Research shows age is the greatest risk factor when it comes to COVID-19, but death rates are highest among those from Black and Asian ethnic groups. When you take things like age, sex, deprivation and geography out of it, people of Bangladeshi ethnicity are twice as likely to die from COVID-19 than someone who is white and British. Other Asian, Chinese, Indian, Pakistani, Caribbean and other Black ethnicities are 15 to 50% more likely to die. And more people are dying this year who were born outside of the country, in places such as South, Central, East and West Africa, the Caribbean, Southeast Asia and the Middle East. But all this analysis still doesn't take into account other social and economic factors, which may explain why we're seeing more deaths among the BAME community. For instance, a person's occupation. People working in industries where there's face-to-face contact, such as social care and transport, are more likely to contract coronavirus, and a large number of people with BAME backgrounds work in these sectors. The analysis also doesn't take into account obesity or other health conditions a person may have. Both are known risk factors when it comes to COVID-19, and obesity and conditions such as diabetes are more common among particular ethnic groups. We know people from a BAME background are more at risk, but it's not necessarily their ethnicity that is putting them at risk. We don't know what it is exactly. That's frustrating because it's important to know, so we can do something about it.
So, what horrific statistics.
Yeah.
So, starting off with, so are there any physiological reasons why the BAME community, our community, has been so adversely affected by COVID?
There are different reasons. Obviously, a lot has been mentioned in the video as well.
Mm-hmm.
Obviously, working environment where most of the people are working because majority of them belongs to lower economic group.
Mm-hmm.
So they are doing different jobs where exposure is more and protection is less.
Yes.
Belong to that part of community, obviously, then it's less healthy ways of living, less opportunities compared to obviously other groups that affects their health and obviously putting them in high risk, having diabetes, high blood pressure, obesities, and these could be the main factors. Along with that, there is one environmental or social factor as well, living together in a big communities.
Yes.
And one home. This is something that is a part of our culture, maybe from Asian culture. It's not just Pakistan, India, Bangladesh, and even Middle East as well. That we love to live together and in a big community with big families, and that was one of the issue that could cause a problem that has basically caused lots of quick spread.
Yes.
And difficult to control. And so these are all factors obviously should be considered that are in some extent, we can say, wasn't quite a lot important before till the COVID hit. And it has showed to us that if you have these things going on in your families and in your way of life, then it's going to be a lot dangerous.
Okay, well, let me just pick up a couple of the points that you mentioned. First of all, culture, our cultural identity in terms of families living together. Now, I accept that families do live together, and in multi-generational. So you have the attic, you have the first floor, you have the ground floor, you have the basement occupied, and so forth. And that's the way we grew up. So absolutely, I grew up around here. In fact, on the other side of the wall, separating the main road from the Heritage Centre in Wally Range, is where I grew up.
Yeah.
So absolutely, fully aware of the kind of the multi-generational lifestyle and living in close proximity. But having said that, do you think there's an argument that the community hasn't taken this as seriously as it should have done in terms of shielding, in terms of protection, in terms of wearing face masks? Do you think there's an argument that the community could have done better?
Yeah. This is the thing. I'm saying that these factors were here, and we are obviously living with in quite a long time here in UK, but those things hasn't come to our attention till the COVID had hit.
Yeah.
And I'm just emphasize one more thing here. Taking COVID not serious or not even. I have spoken to a couple of people because I was always remain in much more in interest of obviously dealing with different issues that are happening in the society. So even coming before to your show, whenever I speak about different people of our community, they are the one who even not only our community, but there are small number of people in the other communities as well, in Caucasian as well. You have heard about America, and they have COVID parties and all these things. They are not taking serious at all. And recently I have spoken to someone, one of my colleague I have spoken to before coming here. She was one of the senior research scientists during this Pfizer vaccination and the Moderna vaccination. And she's working at the moment in two groups who are working in in UK and America. So in America, she was telling that people have completely irresponsible behavior. They are not being Asian or Muslim or from minority people, but even Caucasian people in that area were not taking as seriously and precautions that they have to. The other thing, yes, when you have, and the other thing also.
Before you move on,
Yeah.
may I interrupt you,
Yeah.
please? I took the view that America has been wholly irresponsible in regards to COVID-19 and how they've dealt with it.
Yeah.
And if I may say so on record, that the leadership of the United States of America, starting with President Trump, has been wholly irresponsible and disgraceful.
Yeah.
Because for the want of not believing that COVID actually exists. And I was horrified when President Trump got COVID. And within 3 days, he was in a motorcade going out and doing electioneering. That didn't add. It absolutely horrified me.
Yeah.
That he set such a bad example for COVID, for not only his country. Now remember that, I don't know if you're aware of these figures, but America represents 4% of the world population.
Yeah.
And it, at the moment, represents 25% of all fatalities in the world.
Yeah.
No? That's a heck of a discrepancy. And it starts right at the top. Absolutely disgraceful, reprehensible, and irresponsible behaviour by President Trump. My personal view. And he should have given better leadership on this. And I think America would have been in a far better place than it is at the moment. Equally, I think in this country, there has been the medical advice was there to have lockdown far earlier than it should have, than it took place on March the 23rd last year. It should have taken place perhaps 2 weeks or even 3 weeks earlier. And there were reports that would have saved at present, and this was yesterday on the BBC News, that had we gone into lockdown 2 weeks prior to the 23rd of March 2020, that we would have saved 20,000 lives because of the exponential growth that COVID has had in terms of fatalities. We would now be looking at perhaps 80,000 deaths as opposed to over 103,000 deaths. So there's a lot of responsibility that goes with it. And that's kind of on a wider scale. But having said that, I want to focus on our community.
Yeah.
And the community, I must admit, I've been, my in-laws live in Victoria Park, just on the back of, near where Victoria Park Masjid is. And obviously, Umdla Road is very nearby. And I've been absolutely horrified, not only during the first lockdown, the second lockdown, and now this third present lockdown, that actually you could go to Umdla Road, the Curry Mile, and not actually think that there's a lockdown in place, because people are out walking, shopping, getting their haircuts, and eating, and going to, visiting the shops and so forth. The jewellery shops are open.
Yeah, I think in this situation, obviously I'm coming back to the Curry Mile. I have spoken to a couple of people regarding it as well before, when there was a lockdown, but there was no lockdown in that part of city.
No, there wasn't.
So,
is that because of our community, or is that simply because of commercial reasons?
It was on, you can say obviously maybe there must be different reason, but the government is responsible for law and order. So that was I'm thinking of. There should be some strong legislation, because when I think at the middle of I think in March or April, I have put just a video clip, like a video recording for the people, and in order to send a message. So at that time I have quoted different things, and it was, I think, it was in July or August time.
Right.
Yeah. So, and I have obviously, because of being a doctor, you are involved in NHS, and being a doctor, you are also, we have communication between us and the scientists. And this is how it's going to be a trust between, obviously, the things that has been miscalculated into our communities about that the scientists are doing something to control humans, to control Muslim nation, about this fertility and all these things. The most important thing always and always has in our society, in this world, is a trust between each and every sector. So we trust on scientists, they are doing research with honest way. Being a doctor, we are accepting that, understanding that on the basis of our medical knowledge, and obviously like to give it to the other people similarly, like we find for ourselves. It's not that we, if anything, that is not it's very less likely that something medical professional or scientist on such a level could be involved in something that is much more financial or political, that harm other people.
Into conspiracy theories.
Yes. I'm talking about those. I'm just hitting on those points. But important thing is that in our society, there obviously from this platform, I wanted to go into some important deep points that are raising this that basically creating.
I'd be delighted to hear those deep points.
to create this type of data that has been produced now, that why our community in a bigger amount are not able to come and attend the vaccination time and the date when it was booked, or even not enrolling themselves for vaccination as well. So knowledge is important thing as well. The other thing is it's a bit of culture as well, that one person knows one thing and it stays into the family. It need to be accepted by most of the time. We don't have much of permission of arguing and going against something that has been entered into the family by the members or head of the family. So that may be creating a big one person is thinking of maybe not, it's not good, and the mother, and obviously in our culture, even here as well, that the people, if obviously an old father and old mother, they can't decide by themselves, that they have to go to the GP. Obviously they ask their children, and if the one of the main person or main family member is of this mindset, or have been influenced by some conspiracy theory or different blogs and different YouTube videos and messages and different areas, that this is something to affect the infertility of a Muslim community. This is something to control through messenger RNA, or to in order to change our genetic makeup, and it's going to create a lot of other things. Even I have recently spoken to somebody from Egypt, and she was telling about that. She was mentioning that some of the even professional people have informed her that don't take the COVID vaccination, because anybody who is taking the COVID vaccination is going to die anyhow in 3 years' time, by creating different problems in them. So this is the way of controlling the world's population. So these are different types of things when coming to our community. So because of living in a big home, one person or one thought goes to a whole family, and that is going to be obeyed by all the family members. That contains a lot of persons, and old grandma and grandfather, and their daughter-in-law and son-in-law, their grandchildrens, and then multiple people. So that's the reason maybe the things are in different people, in different society, different other cultures as well. But because in BAME society communities, and especially when we are talking about much more of our Pakistani communities, so that effect has been felt more because of that that misconceptions, those has gone into those families. It goes in a bunch of whole, affecting a whole people, not individual, just individual.
So, if I understand correctly, because I know that of all the Pakistanis and Muslim friends that I have and people that I associate with, and from all other communities as well, they all have these.
Yeah.
And they all have these.
Yeah.
You know? And so social media is absolutely prevalent everywhere. So are we taking a view, am I kind of, if I throw this into the mix, that social media has been a positive influence, or has it been the driver for creating this 20 to 30% did not attend culture because of the misinformation circulating within our communities?
I think it is because of the misinformation circulating in the communities, and unprecedented situation of COVID as well.
Okay.
I'm feeling very sorry to saying that, because I have found a couple of even in America, you know about the vaccination and on hitting about why the situation here is worse now with the COVID and COVID vaccination, because from history it's always started with the vaccination. So people has objection about polio vaccination. Even in different countries of Asian different countries, still they are not allowed to have polio vaccination. They have campaigns against the polio people who are giving polio drops to the different people. Plus then it comes the measles, MMR. Then there was obviously lots of scientific people have involved in telling that this is the main cause of autism. However, that has been obviously rejected and denied. And then COVID came, and then a different vaccination came with the COVID, and then crisis was such a hard that they tried to do and try to make it as quicker as possible in order to save the communities, and they took it in a wrong way, that they hurried to make the vaccine, so it's not very suitable and trustable, and all this is.
That's a great point that you raise. And in fact, today in The Guardian, there was an article that said that COVID is the new polio of the present generation. And people are thinking of it as polio, and all the isolation and the segregation between have you had the vaccine or haven't you had the vaccine, or the close interaction. So I think that's a very important link that you've made, and I think that's now being recognised more and more. I think it's going to create a degree of momentum going forward as to how we dealt with polio and how we're dealing with COVID, because I think there are lessons to be learned from that. But before we go on to the next point, and I want to continue, before we carry on with the discussion, Adam, is it possible for you to play the former chief scientific officer of Pfizer's video slot, please?
Yeah, bring it up now.
Thank you.
Dr. Younas.
We've got it all ready for you.
That's good.
It's certainly true that there is over assignment of deaths to COVID. So not all of the people who have got a COVID death, that is, they died within 28 days of a positive PCR test, not all of those people died because of the virus or even with it. Sometimes they'll be false positives and so on. But I just want to make a quick comment. You've said I talk about testing, I do, but my training also includes immunology, and we seem to have forgotten immunology. I'm convinced, and I hope I can do it in 3 or 4 sentences, that to say the country's broadly at herd immunity. So there's been extensive papers published to show that people had prior immunity because their bodies had seen a related virus, the common cold causing coronaviruses. That's not controversial. Even Public Health England has now published on that front. I believe we're at herd immunity as evidenced by the lack of COVID deaths in London right now, which were about 200 to 250 every day. 7 months ago, I checked 3 days ago, it was 9. So that means it's 95, 96% lower. Now, there are some areas that were hit hard in the spring and are still being hit hard, and it's Liverpool. But a friend of mine, Joel Smalley, has looked at this, and it's the same pattern. There are districts and regions in the northwest that contributed the deaths in spring, regions A, B, and C. I don't remember their names. But in the autumn, it's not A, B, and C. All the deaths come from D, E, and F. So I think there's strong evidence of herd immunity. I advise people to go and look at that. The reason this is important is not that we don't need a vaccine, but it means there's a weaker case still for, as it were, trying to throw ourselves in front of the train by using the vaccine, that's the only thing that'll stop it. I think it's mostly self-limiting, and definitely still people catching it and dying, and mostly the elderly and ill. I would want to see them offered the vaccine first, and I think we should just take a step back and not be so, frankly, so hasty, because it's risky.
Thank you, Adam. So here's Dr. Mike Eden, Chief Scientific Advisor to Pfizer. Pfizer, who developed the BioNTech vaccine, which is the first vaccine to be approved by the regulators. And he's talking about, well, we shouldn't jump in, to use his phrase, in front of a train with a vaccine. We should take a step back and do longer term trials. Now, don't you think that kind of information is also assisting in the lower uptake of the vaccine, or people's reluctance to take the vaccine?
Yeah, this is an important thing. I have mentioned, I think, in the last interview as well. It was related to, in a way, that when the amount of time that the vaccine has been produced, that's creating a bit of obviously disinterest, and also people are a bit reluctant to take it, and then are associated with any comments from people who are quietly highly qualified and involved in this type of research and vaccination, and there was I'm not obviously blaming and even not saying that those our response, our community response should be different in a way that there are different contributor factors, but still being a human being, whenever we get any information and there is any matters comes ahead, like now these days the matter of vaccination is ahead, so you have different type of information available every time, in every moment of the history, and this is human nature, that if there is something comes as a disease, so there are people who are definitely going to they are deny the danger, whether it's going to be a war or any financial crisis. And similarly, if there is anything has been produced to help and for humanity or for treatment, for any treatment, there's going to be a particular population of the people that are going to take it in a negative way, that no, this is something wrong with it and it's not suitable. And this is something that we are learning from the history, and with the passage of time it has been proved. Similarly, like if we are at the moment of time dealing COVID vaccination in the same way as we have dealt with the polio vaccination, we have dealt with the MMR, and now the amount of the people who are having the polio vaccination and we have saved our next generation is tremendous. So the history has proved himself that helped people, and now time came for the vaccination of COVID. However, there is a misinformation is spreading by different people, even from some of the people related to the health professional, from some scientific research, the people who have the different thoughts about what developments in the science is happening now and how is affecting the human beings and how we are going to treat and deal with these things. There are also the way to clarify and verify the things, and that's the most important thing that the people have to think at this moment of time. This is a matter of life and death, and it is a hard work has been done. A lot of people who are sincere to the humanity and want to do work. There are always side effects and obviously risks related to every treatment that we are getting, even a paracetamol that we are taking for temperature, even that has the risks and obviously their side effects. But the main purpose is to treat a problem that is desperately need to be treated, and there is a matter of life and death, and there is a matter of just the side effects. So I am just emphasize for each and every person of our community and the whole from whole population of United Kingdom and the whole world, that whenever you have two different information and there is a matter need to be done, so we should have to put our efforts to find the correct information and correct truth, and then follow it.
Right. So coming back to, so you're right, absolutely, there's a lot of misinformation taking place, and one of the things that I will touch upon later on when we go through the report that's published on the 19th of January this year, GPs raise alarm over the low uptake of COVID-19 vaccine BME patients. There's a real crying need for education here. And one of the things I'm very disappointed with the government is that in the past I remember that there were educational programs regarding AIDS, because I'm old enough to be associated with, not with AIDS, but with the educational programs. But there was a real drive to educate people to say, these are the precautions you need to take. But there seems to be an abject lack of information from the government, apart from a few radio adverts to stay in, don't do this, don't do that. But there hasn't been an education drive for the vaccine.
That I was mentioning to you that when I have that recorded that interview, and then I have put on different steps. So obviously initially it's going to be, obviously we have to provide the more testing centers and helping people to improve the immunity and all these things, and putting government to put different legislation and the laws so the people should stick to the law. It's all in this is the responsibility of the government, that I am 100% saying that. Regarding you're talking about the Curry Miles in Rush Home, so that is the part of the government, United Kingdom, nation's territory. Any law that has been enforced and that is important for people's well-being need to be enforced. And I haven't saw anybody coming there and looking and anything from, if I bet here that if one of those shops that has opened there, any one, two, or couple of people if get fined there, then next day there must not be anybody who is opening the shops, or there must not be a lot of people coming there. But nothing has been done. It was too strange for me, because I always compare between Belgium, because I lived in Belgium a long time. I come and go, and during the first lockdown I was in Belgium. So in Belgium everybody has to wear the mask. And if anybody, and there was, I have found myself, because we were just going to the next streets to our town where only takeaways are open, and the police people are walking, driving through on the bicycles. They are riding through the bicycles and checking everybody, and if there is anybody is there sitting together, and they just come down and then ask them why you are here, and this is, you're gonna get the fine, and people got the fine. And when I went next time, there was nobody in any of the streets or takeaway supermarkets where I went without mask or any gathering, because they are enforcing the law. This is human nature to work against the law, and it's not that people gonna understand until unless everybody is gonna be hit by COVID, and very near, very close and near and dear are gonna die. And even now, lots of families are affected, and now they are realizing, okay, COVID is a reality. But we can't leave things in the hands of all the people. When being a government, we are responsible for a whole country. And
I totally agree. The laws are in place, but they haven't been policed as effectively. Now, if you take the police reaction during the first lockdown, which was all very much stay indoors, you can go out and do exercise once a day, and no meeting with other people, and so forth. And people generally stuck to that. I mean, I'm very fortunate. I live out in the countryside, much further south from here, and live in a small village, and people are really adhering to the rules. You won't find anybody, very rarely do you find people breaking the rules. But when I've come to the Curry Mile, and I've come to Manchester and seen some of the outlying areas, people are breaking the rules. Now, it's interesting that in the second lockdown there was a greater police presence, and now in this current lockdown there's far greater presence. And I hope that the police endorse and punish those people who are breaking the rules. Because if we haven't learned by now that wearing a mask is important, because it cuts down the transmission, the aerial transmission I think it's quite a significant number. Is it 70% or is it around there?
Yeah, it depends on the different type of mask.
Okay. And if we haven't learned from the first and the second lockdown, and we're seeing, was it 1,710 deaths recorded within the last 28 days of a positive COVID test today, the second highest so far, not that far off the highest, then what are we going to learn? You know? And I'm so pleased that the government's now introduced restrictions on air travel, that Priti Patel today said people will be asked why they're leaving the country, and it'll only be for essential business travel, not to go on holiday, not to go on so-called work, social media stars going to Dubai for work, when in fact they've gone for an extended holiday. And it really annoys me that that's happened. It gives the wrong impression. So I hope the government does come along and say, and starts enforcing the rules that are already in place far more harshly than they have done. And I hope that will have an impact on the COVID infection rates. But in terms of our own community, I'm going to be slightly judgmental here and say that, in fact, our community has a very has a sense of it won't affect us, and that's evident if you walk along the Curry Mile. That's evident if I've seen quite a few social parties taking place on social media. People are completely ignoring the rules and thinking, no, it's all right. We're young, or we're not going to be affected by it. And I want to send out this message to anyone who's listening to this and who has broken the rules. Please just stop. Think about your parents. Think about your grandparents. Think about your uncles and aunties. Think about those people who are older in our community that are much more vulnerable than the younger people. Although COVID is no stranger to young people. So think about the rules that you're breaking. The rules are there for a reason. It's to protect yourself, it's to protect your families, to protect your loved ones, and also to protect your community. And right now, we all need to stick to the rules. We need to come together and just do our little bit. And if that means, if as a Muslim, and we were talking about Sadaqah earlier, if you treat that as part of your Sadaqah duty to wear a mask and not do something where you're in touch and we're in contact with other people, if that's the only way that you're going to understand that you need to obey the rules, then so be it, because actually it's our community that's suffering the greatest in this pandemic. It's our Muslim brothers and sisters and our Muslim children who have suffered so much within this pandemic, and the statistics are there. So please, let's make sure, if you're listening to this podcast, and this is from the all views expressed on this podcast are those of mine, not necessarily those of the British Muslim Heritage Centre. I've got to get that legal term through. But my view is that if it just takes a small amount of change for us to be able to protect ourselves, protect our loved ones, protect our family, protect our communities, protect our friends, and shorten this pandemic even by a day, I think it's well worth that we should do this. So I'm going to take a small break, and Adam, can I ask you to play the video of the MP, please? Because I want to take up the next series of questions, which is how we've come about, why people, where this background of information about people being so, having such disregard. And I think it starts right up at the top with the British government. And we've got a clip here, which hopefully will explain something that I vehemently disagree with, but nevertheless, the information is there. Adam, go ahead, please.
If you were to ask a scientist, how do you stop a virus that spreads through human contact, do not be surprised if he answers telling you that you must stop human contact as far as possible. It falls to us, however, to decide whether the price is worth paying in terms of the misery and unemployment that it generates. A generation marred in their life chances, mind-boggling borrowing that we will have to repay over years, which will diminish proper investment in public services and industry. All that, and for what? The Secretary of State has told us this week that the average number of deaths is consistent with the long-term average for this time of year. 1,600 people die every day, but COVID is by no means chief amongst their killers. And it's no good to say that, well, every other jurisdiction in the world is following basically the same policy. That would strike me as herd stupidity. And speaking of herds, I understand that a number of ministers have questioned the existence of herd immunity, which is odd, given that a successful vaccine programme relies on herd immunity, and that is the basket into which the government has placed all its eggs. Throw into this mix, Madam Deputy Speaker, the fact that we appear to be determined to claim every possible death as a COVID death, as if we were in some sort of international league and competition. Add into it the failure to be absolutely upfront about the limitations of the PCR test as a means of tracking the disease. Add into that mix the way that we use large numbers to terrify people. We've been told that intensive care units are at 80% of their capacity. Of course, at this time of year, that is exactly what you would expect them to have. No wonder our constituents are writing to us with ever greater conspiracy theories, because our actions defy rational explanation. Now, hallelujah, the consensus has been broken. The Prime Minister has finally resisted the advice that he has been given by the scientists, just at a time that the opposition have embraced it with enthusiasm. Now at least an argument can be had, and proper scrutiny and freedom from groupthink will arise. The danger is, If we do not change the way we respond to this disease, in years to come, historians will pick over how it was a prosperous society entered into such a devastating act of self-harm.
And that's an MP in the House of Commons,
Yeah.
spreading so much, not necessarily misinformation, but
the other side of the picture, economic side of the picture.
well, the economic side is important, of course.
But I think economic is important when there are human beings to use the economy.
Yes.
And when there is a matter of life and death and the money. So I think everybody can understand this thing. People for whom the human life is not matters much, but the money and economy and politics, obviously you can find in every time period of the history. The most important thing here is that being because I have discussed a lot of background, what could be the reasons of our community to thinking like that. All the contribution has been played by this type of the people in politics, in medicine, in the science as well. And these are almost equal. And I think much more in the Caucasian society, Caucasian community, that the people on a higher rank are putting this misinformation, and very few of them that I have been obviously seen on YouTube, maybe because of the use of the media is much more in their hands and they are utilizing in a way. It is responsibility of each and every individual and human being for their own actions and for anything that they want for themselves and saving their lives. I am just simply saying to everybody who is confused or doesn't want to have COVID vaccination because of particular reasons, they are thinking of having COVID is and vaccine being a haram. By mentioning here one more thing, that in even our religion, when there is a matter of life and death, you can even use those things that are forbidden in normal circumstances. So I think we are just moderate. We are just the people who have the basic knowledge of Islam, and still this is the reality that our religion and our God has given, and that God or nature for the other people who don't believe in God is the thing that understand humans, human diseases, their cures and everything. And being a Muslim, if we can say, there is no disease on this earth that Allah has not created a cure for that. And so being a Muslim, it's I'm now just focusing on our BAME community from now onward, and using obviously all the aspects that they are using for having vaccination or not having vaccination, that on the basis of our religion, there is, I think, nobody has mentioned up till now from any other religion of the whole world that are claimed to be, obviously all the religions are, I respect all of them, and they have in different ways they have guidance, but how particular and how specific guidance that we have from our Prophet Muhammad sallallahu alaihi wasallam about the pandemics, that according to, I just would like to mention the hadith that if any area get any pandemic, we are, being a Muslim, it is our duty not to leave that area, and the other people who are out of that area should not go into that area affected by pandemic. This is something that has been now taken as a quarantine. So the concept of a quarantine is for us being a Muslim from our religion, and this is the obligation of us being the followers of Prophet Muhammad sallallahu alaihi wasallam, that if none else but we should have to follow it. And regarding that other things, because the basic thing of education and the knowledge is very important as well, and that is playing a lot role as well. I just have seen a couple of days before video, like YouTube video, a person is coming and standing, and there was some, I think it may be in Heritage or somewhere else, that from our Muslim community they have offered a place for the vaccination, a big place or hall for the vaccination, and there is a person with another person obviously making video with the video for him and playing that video on the YouTube, and saying that you are doing haram things and you are involving in that fitna, and you're giving this vaccination is haram, it contains haram things. So obviously even I'm addressing that person, that if you're thinking this is the way, this is something, so you have to go into details, ask for the ingredients. Yes, so ask for the ingredients that okay, I have this information, and this is the authenticity from the department that producing the medicine, because that this medicine contains this illegal, haram things according to our religious belief or belief of different sects of our religion. And even mentioning that thing, that if it is a medicine and something has been used for it for the purpose of saving a human life,
it's
still halal.
Exactly.
So yeah.
So that brings me back very neatly to this report, which is printed on GP Online. So Adam, if you could take to that report, please.
There you go.
This report that came out by Luke Haynes on the 19th of January 2021. And essentially, for those people who can see that, GPs raise alarm over the low uptake of COVID-19 vaccine in the BAME patients. And this information is literally hot off the press. And it comes from a number of very eminent clinicians who are administering the vaccine. So I have no doubt that this is truthful, and I think we should use this report, which anybody can go on gponline.com and type in BAME uptake or vaccine uptake, and they will come up with this report. So we're not pulling any punches here. We're simply saying, if you have any doubts, go and find the information. But please use your common sense and use your intelligence to filter out what is rubbish and what can be believed. Now, generally, when I'm overseas, I travel a lot. I always go back to bbc.co.uk or bbc.com because I can rely on the news to be reasonably accurate. I also use a number of other channels, but I'm going to stick to the BBC for the time being. And also, excuse me, I'm just going to make sure my wife, who's now ringing me in the middle of my podcast, knows that I can't talk to her. Thank you, lovely.
Be careful when we are going home.
No, I sent her a message saying I can't talk, so she knows that I'm busy. If I ignore it, then I'm in trouble. So this report that came out by Luke Haynes says that GPs across England have raised concerns over low uptake of COVID-19 vaccination across the BAME patients, warning that misinformation has left patients reluctant to come forward and pushed up do not attend. So the primary care networks and in North Staffordshire, which is 30 or 40 miles away from here, the rates of people from BMHC communities who did not attend were 10 times higher than the average. And GPs across the country have raised concerns about the low uptake amongst our communities. Now, what I want to say on this specific report, we've raised a number of issues about why the vaccine has hit our community so much harder than others. But on this point about uptake of the vaccine, we have a realistic, real-world opportunity to press home that this vaccine is, first of all, halal, does not have alcohol, is not derived from pork products, and as Dr Andleeb, you raised, that in our Prophet's hadith, there is a real message that we can take, that actually the vaccine in exceptional circumstances, even if it was, and I'm reluctant to use the word non-halal, that it becomes halal for the purpose of the vaccine being taken by the population. So let's just deal with those. In this, the vaccine minister, Nadeem Zahawi, has warned that the virus could spread quickly amongst the BME communities if they make up a large proportion of those who do not take up the chance to be vaccinated. The government scientific group for emergencies, SAGE, that we've heard so much of, has also warned of a significant risk that the vaccine uptake for COVID-19 would be lower amongst minority ethnic groups and call for barriers to uptake in these communities to be understood and addressed. Very, very clear that there is a problem there.
Yeah, and then we have to be in action in order to tackle.
So how can we do that?
Because as I'm mentioning about somebody YouTube with the YouTube message having this haram and all these things, but there are also a lot of YouTube videos about different imams and muftis and different other quite active activist people whom people can believe in, having given the message, taking the vaccine, and even there is some fatwas as well that has been given by some of the imams as well regarding that use of vaccination, and obviously helping people to obviously resolve or be in peace regarding keeping in mind that okay, maybe we are doing something wrong that is not according to our religion, and that fear contribute to be reluctant to go at the point.
On that specific point, Adam, can we go on to the British Muslim Heritage Centre Facebook page, please? There we go. And can we just scroll down to the quotation by Imam Rehan Salim? There we go. I'm going to read it out. It's easier for. Thank you for making it bigger for my old eyes. Let me just quote the quotation from Imam Rehan Salim on the Greater Manchester Imams Network. Though we understand that it is ultimately Allah who cures, we are still meant to take the means available to us. This is the tawakkul, trust in Allah. Yeah? Therefore, I encourage those who are vulnerable and have underlying health conditions to get vaccinated. So that reinforces the point, and this is on the British Muslim Heritage Facebook homepage. So we're trying to get this message out, and actually the vaccine is halal. It's halal, even if it wasn't halal, and it absolutely is, we still have the hadiths that say in exceptional circumstances you can take the vaccine. But also, let's debunk this theory, the conspiracy theories that there's alcohol based. That the vaccine from AstraZeneca and from Pfizer are alcohol based. Is there any truth in that, Doctor?
I don't want to comment on it in a way that I am not involved in research directly.
Okay,
I doesn't want to. But how much I have spoken to you before coming.
Yes.
Obviously being on myself, like if I'm thinking of myself, so I'm a person, I'm a Muslim, belongs to a BMHC community, and I heard a lot of these things that created doubt in my heart as well.
Yes.
But whenever anything comes like that, I have to find out which is right and which is wrong, and in which way I have to go. That I am telling to everybody and every person in our community that they have to see, for everything there is always 2 points.
Yes.
Yeah, positive, negative, every two sides of thing, but we have to follow the truth and follow the right thing. For that we have to work hard in a way that we have to do a bit of research. I was just mentioning one important thing that was a bit more what is happening in our society, our community, that my colleague that she is a chief scientist in during the research and trials of Pfizer vaccination.
Okay.
And I have quite a detailed discussion with her about the vaccine, different trials, numbers, their SAE, that are the severe adverse effects of related to any medication that we are whenever we do the trials in order to see that, and also a comparison of different vaccination that is available at the moment. So then she has spoken to a couple of people, and they said that people are saying that this vaccine has something in it that's going to change our genetic makeup and DNA. And even those people who are talking about this thing, they don't even know what is the DNA and what it means and what even contains in the vaccination. So this is very important thing, that if we have seen this type of misinformation in the society, in the people that are not well educated as well,
Yes.
and then we should have to educate them, and we have to spread better information and the correct information more, and emphasize on the people that whenever you get a doubt, it's your duty. Being a Muslim, it is our duty.
Yes.
Don't spread a thing. We are not a Muslim if we are, according to Prophet sallallahu alaihi wasallam in a hadith, for a Muslim, he is not a Muslim if he is saying something that he does not have a correct information about it, that he don't have the proper base for that, and just spreading information just because he has an information and he is spreading one to another. This is just, I'm telling in a summarized way, that we are not allowed to even spread an information that we haven't been. Okay, somebody said to me, being a Muslim, what is our duty at the moment? I'm not telling to everybody, but this is my duty. When I'm getting any information from anybody, okay, this vaccination is haram. Okay, then I said, oh, why it is haram? I have to find about it, why it is haram, and what is in ingredients of this vaccination. And for every medication, there is ingredient published and also mentioned, and also written down whether it is vegetarian based or it is animal based or something. So we have to do a little bit of research, and that is our duty before I spread this thing from my mouth to another person, that okay, I heard about that vaccination is haram.
Yes.
Or it has pork constituted in it, or it has something that is not permissible. So this is our duty. We have to be more vigilant, being a Muslim, much more, that we are more responsible. On our shoulders there is a bigger responsibility, being a professional, being a Muslim, being a member of the BME community, that we have to follow according to our religion. This is our duty, to spread the true information, and also don't spread wrong information and just spreading and sending the messages. And we also engage those people and also involve them and challenge them that if you have spread this information, go into the details and prove it. And in the same way you spread it, you have to spread the right information after some of research that you have to do it. And this is the responsibility, and we should become more proactive and being a society.
Well, I totally agree with you. Absolutely agree. And this is why I want to read out the quotation from Mr. Nadeem Zahawi, who's the vaccine minister, who said on Radio 4 this week, I'm worried that the BAME communities, which is why I'm spending a lot of time with the metro mayors, the Mayor of London and parties of local government to reach those hard to reach groups. How are you spending that time? Because here we've got the British Muslim Heritage Centre. Have you been in touch with us? Because the question here is, we know we've identified a problem. We know that there's a problem. And 20 to 30% did not attend in our community compared to 2 to 3%, a 10 times greater number. It's a shameful number.
Yeah.
Because it's an absolute waste of resources.
Yeah, it is, and you think about this number, mean 20 to 23% of just basis of
20 to 30%.
20-30% of just basis of this thing, that you thinking that if somebody is not taking life-saving medication, 20 to 30% mean these people are gonna die with the severe COVID and gonna spread it to the lost for the people.
And remember, at the moment, this is only going out to the 80 plus, then the 70s. We haven't got to the younger population. They're still at risk. And 30%, 20 to 30% did not attend. It's a disgraceful number. But I accept that the number exists. And the question is not, oh, it's a disgraceful number. The next question is, what are we going to do to reduce it? And this is where the challenge comes through. Because Mr. Zahawi, it's all very well you saying that you've identified the problem. Well, the solution to the problem is that you need to run detailed information campaigns targeted to the various communities that are representing those 20 to 30% DNAs, and get this misinformation, challenge the misinformation, and get the information out that the vaccines, whichever ones they are halal, don't contain pork products, don't contain alcohol, and dismiss this misinformation and provide a counterbalance to all the other information that's been going around that's created the problem in the first place. So, Mr. Zahawi, here's a challenge for you, and I'm happy to assist you in this matter, ably assisted by Dr Andleeb Younas. If you want information about how to reach the hard-to-reach communities of the BAME groups, come and talk to us, because we know how to reach them. We'll help you. And this is a voluntary show. We're not asking for money. We want to do our sadaqah. We want to reach out to our communities, and we want to reach out to the wider communities. And all you need to do is come and ask us. And there's so many professionals, particularly from the Association of Surgeons.
Physician and Surgeons of Pakistan, and there is the Association of Physician and Surgeon Pakistan Foundation, and they have, and I am the chair of APPSUKF Foundation Women Empowerment Group, and that is doing a lots of work during the COVID and helping people, and they are ready to go and help and to remove this type of misinformation
Yes.
and doubt of the people, because there are majority of the people that want to get the vaccine just because of the pressure that is going around them, misinformation around them doesn't want them to go ahead, and maybe that's the reason they booked the appointments,
Yes.
but they didn't come because they are confused. And there is and this is the duty of being we BMA member in different, in medicine, in science, in research, who are in this community and working in this society, and also the basic duty of the government as well, that there is a problem, there should be an active way and for them to act upon it and make a plan, and we are completely help them, support them in that, to help and to sort this out, and to go to those people and to go to those communities and the GP, and especially starting from the GP in every area, because every local area of the GP have known the number of BME communities who are, how much they are, and how to spread the information. So we are obviously, I like to discuss with you and what is my point of view, how we can help to solve this problem, and they're going to be obviously your point of views as well. But there is the way the government should have taken, the action taken by the government is going to be much more effective. And obviously it's going to be greater scale, and on the basis of their support. So it's a duty of the government to take action to resolve this problem.
Andleeb, Mr. Zahawi, forgive me if this sounds like constructive criticism, but I think our shoulders are all big enough to be able to take constructive criticism. But it appears to me that the government did not anticipate this reluctance. This did not attend the vaccine.
Yeah, can I interrupt one more thing?
Please do.
So it is a shame, a bit a shame thing. Obviously, I am using this word in a quite painful way as well, because this is APPSUK, Association of Physicians and Surgeons of Pakistan, that who has been presented for the first time in BBC. If you go back and play it in the BBC News, that's and a report about that most people in our medical profession who has been affected and has died during this time, this pandemic, was over frontline. Most of the people who are in frontline, majority of them was BAME community. So I was thinking of, in a way that there should be a research or report should be published by some other departments and associations who are UK based, because APPSUK is the community, is obviously physician of surgeon and physician party and foundation for Pakistani origin.
Are you part of the association?
Yes, I am. I'm part of APPSUK, and APPSUK has a foundation to work for as a charity in different, and we have now newly we have found last in February of the start of this pandemic, we have started Women Empowerment Group in order to particularly deal with all the challenges that the women's has, because from our point of view, being a Muslim as well and being any human person, and we know any problem related to the women of the society is going to affect the whole generations. So those, in order to tackle those issues, basic issues that are quite severe as well, there are lots of other issues other than this medical and vaccination issue that our BAME community particularly having, especially the women part of that one. So we have found, we have obviously put a foundation for this one, and we are working in a different way, and we have done up till now great and creative projects as well.
Without putting you on the spot, but it may come across as putting you on the spot, so I apologize profusely in advance. But if we can get your association to come along as our next guest and make their recommendations to our community, to our wider community, based from here, the British Muslim Heritage Centre, do you think you could ask them, or could you bring them here, please?
Why not? I'm going to bring them. It's so, because being a Muslim, it's my duty to tell the truth. To remove the misconception. This is what our Prophet ﷺ done. He did a long time ago. He came to remove the misconceptions about Allah, about different customs and different customs that is happening there, and the reasons behind them. They were doing cruel things, but they were justifying those things. Similarly, in every era of humanity, there is always people who follow the truth, and there is always people who create the myths and who create the suspicion and who put people into chaos and confusion. So it is our duty to follow his path, sallallahu alaihi wasallam, and to search for the truth ourselves for the first, and then spread it, and then help those people who are confused, who are helpless, who are going to put themselves in a disadvantage because of being ignorant and not having some information and not having proper knowledge of something that we have to do it. I already spoken to someone, as I mentioned before, about the research person, because I doesn't want to say with confidence that, okay, I'm coming and I am defending vaccine here just because it is a government policy, just because I'm a medical professional, and just because we trust on scientists being a
all
medical
the perfect reasons why you should.
Yeah, which I should be. But still, being a human being, it is not important for me. And obviously, we are not here for publicity or anything, because this doesn't gonna make much difference to ourselves, our life, or hereafter. That I believe. The most important thing was that I wanted to help to spread the truth and wanted to help the people who could, in ignorance or because of some misinformation, could harm themselves and harm in majority of the people and harm their loved ones by not getting vaccination by themselves and not giving vaccination to them. So I have spoken to that colleague of mine before coming here, she was chief scientist in research, Dr. Asma, and she is involved in the Pfizer's vaccination trials, and she has told me each and every step because of direct involvement, how they turn toward the making of vaccination, how different trials has been done, how even those things, obviously being a chief, being a main chief research scientist, she was involved, and she has all the papers written down, scientifically approved, that she was personally involved. So I have searched whom I'm going to talk, and then I went and talked to her, and obviously I believe on her because she is the one who was involved in them, about the vaccination, its ingredients, its side effects, which is better, what you think about this, all conspiracy theories. Did you have any of your colleagues who have similar thoughts, and did you how you met them, and how you think about the similar vaccination that you're making for the other people, for yourself. And then I become confident enough that I came here today. Yeah.
Well, I thank you for your time, because I know you've done this voluntarily, and you have young children, and it's an important time that you've shared with us, and I'm absolutely grateful for that. But I'm going to throw you another challenge. As you know, I do the radio show here at the Heritage Radio, the British Muslim Heritage Centre, every Friday morning, and you've been a valiant and wonderful guest in the past, and I would like you to continue with that, and ask you if you'd be kind enough to accept my invitation to come back to the radio station with your colleague, because that platform I absolutely can guarantee we can use to get the misinformation about the vaccine and how the research and all the questions that people are going to raise when we do a live show, we can get that done. And if you could please consider that, and let me know later on, so I won't put you completely on the spot. If yourself and your very kind and dear friend could come along and do the show with me, I'd be delighted if you could. Yeah.
The one thing that I have emphasized last time as well, I think in my last interview, regarding how quicker, people were thinking they take a bit of and they were thinking that because they have taken maybe they have missed some steps, they have done a little bit of less trials. So I have obviously did a bit of research previously as well, and I've spoken, and this time I confirmed with her as well. So she has mentioned to me that because basically she was already in research, so regarding different vaccination in the scientific world, like in economical world, engineer, in any even in the house, we know we are always thinking of improving things, and obviously hitting the challenge that we could face in the future. So she was because she was working with the Pfizer, so she was involved already in working on the children, and they are doing research about cause of meningitis, why meningitis, is just hitting the children and affecting them, and it is a big cause of mortality as well. So while they were doing that research, and the COVID came, and it came in quite a big hit. So like any sensible person, a government person, a family member, a scientific person, they have halted everything that they were doing, and they just focused on COVID. And then they start the research, and there was nothing like any any steps they have missed, or they have done a bit of quicker things, and that could may cause some of the points to be missed. They have done a lot of research. It's just only that because everything has been focused just on the COVID, they stopped every other thing. So 1 or 2% in normal situation that is working now, they are working, all those people just working on the COVID. And then they have been thoroughly, trials has been done, the work has been created, and then obviously effects on people, an adverse effect on different ethnicities, different age groups has been done. But the issue also here is as well, the one issue that she has raised, and one issue that most of the time we complain, being Asian and African people, that the most of the medicine has been made for the Caucasians. Because they has been trialed on the Caucasians. And she have mentioned, and I love to emphasize as well, that when the people are, and scientific people are asking for the people to come as a volunteer for the trials, for these studies, these are the people who are not coming for the trials.
That's right.
And
Absolutely.
then
I remember you saying this on the radio, and I had Dr. Phil Kara, who was leading the vaccine rollout for the government, and I interviewed him on I think it was the middle of November, I think a week before we did the interview with yourselves. And I was pleading on the radio station to say, look, people, go out and volunteer for the vaccine trials, because how will they know what impact it's going to have on our communities from a scientific perspective, not a social or economic perspective or a cultural perspective. So you can't then turn around and say, well, actually, no, I'm not going to take it because it's been designed for so-called Caucasian vaccine. It just seems that we seem to pick on a particular vein and run with it, or a vein of thought, without really considering all the options to it. And I think this is a valid point, that actually, has the vaccine been tested on the BAME community? I hope it has done. I can't say that I know a great deal about that, but I hope it has been done. And that if your colleague can then give us some more empirical evidence or clinical evidence to support that, I think that might be one way of reducing the confusion and the uncertainty, and reducing the did not attend percentage that we're so shamefully aware of.
Yeah. So and from through this podcast and through this media, I wanted to emphasize for the people as well, and I like to encourage them that any person who has any doubts about being halal and haram, and about the ingredients, about the process, about the time period that has been taken down. Obviously, she is the one who was involved in research. Obviously, and then she can give the answer.
Is that Dr. Alma?
Dr. Asma Ali.
Asma, sorry. Right.
Dr. Asma Ali. So we are going to then obviously this is any person who has any doubts and who has already spread some doubts. It's her duty or his duty now to clarify themselves from the people who are involved, basically, who knows about the thing. And obviously I am talking about being a medical professional, being a BMA community, being a member of and chair of a society and foundation that is helping people and thinking of responsibility of helping others to find the truth and get advantage.
You didn't tell me that you were the chair of the foundation.
Yes,
Kept that very quiet.
Okay, maybe. So I am a chair of APPSUKF Foundation Women Empowerment Group.
Okay.
And we have started lots of projects, and one of the projects I have mentioned you before as well. It's about we have lots of projects to empower the women in Pakistan, and even helping people, women's here, and dealing their socio-economical problems. And now under our foundation, we have started limb project. So these are bionic limb projects that all the people who have congenitally or with some trauma accidentally lost their limbs. So we have a very helpful colleagues from orthopedic surgeons and from this technology that are helping us to make a project. So we are going to build a factory in Pakistan, and we are raising fund at the moment for that, and we are going to fit those locally on the basis of the engineering and the facilities that is available in the whole world. We are going to make those limbs and providing those to people.
people with congenital deformity, or is that for people who may have been? And I come back to the
Yes,
the reason why I
in
said
any
it
reason
wasn't
they
question,
don't have a limb,
because exactly
whether
because
they are children or
in
adults.
Iraq and in Syria, landmines and IEDs going off and severing limbs, and this would be a great way of
Yeah.
giving people their life.
Because remember, because we have done this in a smaller scale in Pakistan, and they were tried in started in the Sindh, and it has been tried there and asked for the local government to help them, but because of the political reasons they haven't let them to continue. But during those time period, you can imagine a person who is begging on the road, having no limbs, and then he got the limbs, and we have provided her obviously the limbs and provided her a card, food card. So there is one of our because obviously when we are going to talk about deep in our my foundation, APPSUKF Foundation Women Empowerment Group, then we have done so many swimming centers that has been started, and women has been educated and then went back as a financial supporting member of the families. It has been started in different deprived areas of Pakistan. We have a water project, we have eyesight projects where we provide cataract operations, and we have those I want to earn not beg projects where we provide food cards to the people, those people who are begging and having nothing to earn, to making them to earn. So these are the different projects that we have already started, and one of them was like this, that person who don't have a limb and he was begging, he got the limbs, and then he got the food card to sell and earn a respectable way, a respectable earning for their family. It is a huge effect. It is a huge advantage you can give to any human being.
Giving them back their dignity. Absolutely.
And
Well,
it's just not one
in
generation.
that case, I think you're going to be a permanent feature of my radio show, because come along to the show and talk about this, and let us help you raise some funds for your particular cause. And the other thing I just want to mention, you mentioned your women empowerment groups. And I hope, Nazir, you're watching this. This is my wife. She works very much with different groups where the promotion of empowerment for particularly the Muslim community, both here and in Pakistan. So I think I'm going to get the two of you together, and you can sit
Why
and
not?
have a very wonderful. She comes from a legal perspective, so I'm sure she'll be able to give a legal view on how she can support your charity.
Yeah.
That'd be really lovely.
Yeah.
Um,
And you know that, like, we have just raised this issue, and there are now obviously evidence proved percentage of the people who are not having the vaccination and could be potential obviously harmful effect on them in the future. Similarly, there are a lot of things that are happening in our culture, society, and BME society that affecting socio-economically to the people, and it has been published now,
Right.
and obviously in journals and public on a government level figures that how the women's of this part of community has been affected and not knows proper information, and obviously that affects our generation, that affects the generation of United Kingdom to be make themselves a confident citizen of this country.
Well, I think if we empower the young women of our community, because from my generation there was some empowerment, not a great deal. I think there's a very strong correlation between empowerment of women in our community and the success of the next generation going forward. And if we can create a greater dialogue and provide the tools for that empowerment, then the Pakistani community, the Muslim communities in other parts of this country and in Manchester, where the socio-economic grouping for our communities is very poor. I think that would be the key to unlocking a vast amount of resource to help our community and the next generation. So again, if you want to talk about that, you're most welcome to come along to the radio
Why not?
station.
Why not? And I wanted to obviously emphasize on the government and from this platform that
Okay.
it is not only the people from the same community volunteering their work and thing. It is also responsibility of the government, because these BME community people are the citizen of this country, and those things that are affecting them, harming their socioeconomic status, their mental status. There are lots of things going on there, and it has been highlighted on quite broader way in statistic manners. So it is the government duty as well. We are here to support them, help them,
Yes.
but it is the government
But we
duty of
also
the
have
government
to
as
have
well.
a means, and I think here at the Heritage Centre, we have access to the corridors of the council and the corridors through the MPs to the various government departments, where if we were to put together a project, a specific project with the budgets and with the outcomes that are visible, then I think there are funds there that we can unlock. It's just that I think our community is very poor at asking.
Yeah.
Yeah.
And knowledge of something that the most important thing is when you start digging any problem, you always find the ignorance about that, not having knowledge about that thing, and even not having confidence that that problem could be solved.
To give you an example, right now, with the government putting together the furlough scheme, the self-employment scheme, also the discretionary grants for businesses, and also the business rate support scheme that they put together, you'll be surprised. I mean, our community, the Pakistan and the Muslim community and the Asian community here are business people. They have lots of businesses.
Yeah.
They're self-employed.
Yeah.
But they don't know how to apply, or they apply in the wrong way. And so many of them have had their applications turned down. And so I've been banging the drum to say, whoever wants help, completely free of charge, if you want to help, fill the form in. Come and ask, because we'll help you fill the form in. Because there's and if your application gets turned down, we know how to appeal.
Yeah.
And we'll appeal for you, because at the end of the day, your business needs those funds to survive.
Yeah.
And you have a right to those funds.
Yeah.
But you must ask in the right way, and I think this is a problem that we have.
Yeah, and this is the way that we have to address in a specific way now every challenge, that we have to reach to the people. So information should reach to the people. If I don't think if anybody knows there is a source available that can solve her problem or his problem, or there is somebody there to help them, they are not going to turn to. So it's our duty now. We know, obviously, now in the vaccination case, that we know that people are hesitant, have not proper knowledge and misinformation. It's our duty now to go to these people, to reach these people, to obviously remove that misinformation, to correct them with the confidence, with the true statistic data and on the scientific basis. And then obviously we can obviously say that, okay, we are doing what we have to do, and this should be done on the government level, and we are there all the time. We are doing on ourselves as well, but obviously we need government support as well, because this is a government duty as well, to help those people to reach those
I hope this podcast is our contribution towards the start of that journey.
Yeah.
The interview that we hopefully will do on the radio show, the live interview, will be the second step towards that journey. Yeah. And from those, creating the video, the visual media, which we have one of the best people in the industry for that. Adam, I'm talking about you here.
Appreciate it.
Yeah. I'm singing your praises from the highest rafters. We want to create the visual media, the message that hopefully we can then give to Mr. Afzal Khan, we can give to Mr. Nadeem Zahawi, we can give to Mr. Hancock, we can give to Prime Minister.
Yeah.
We'll reach out to them, but we've got to have the material. And I think this today is the start of that first step of that journey. And I'm really grateful for your support in this, and for your time and energy and effort and passion that you bring to the table. Thank you so much.
No, most welcome. It's my duty. I'm thinking it as my religious duty, and as a duty of being a human being, a human person to help other humanity.
Can I raise one point?
Yes, please do.
Right, so I brought up an article on the screen there.
Yeah.
I was interested to know how effective the vaccine would be at preventing the spread, because everyone was waiting for the vaccine so that we could all get out of lockdown.
Yes.
But if the vaccine doesn't stop the contagion,
No.
then how does that help towards, breaking this situation at all?
Well, that's a great question to put to Andleeb. Do you want to answer that?
Yeah, why not? I think I'm glad. It's a very good question, Adam. I'm glad that you have raised this issue. I think we were about to miss this one.
Yeah.
So the important thing is obviously the lockdown. The first thing that we did that lockdown to stop the circuit of spread. So obviously we know the virus spread through the contact, and we've been putting people into the lockdown and helping that spread, helping that cut that chain of spread. The vaccine obviously going to treat people and producing immunity in your body, that if they are getting any virus, it automatically, obviously you already have antibodies in your body that gonna kill the virus. Obviously when the virus is not in your body, it's not gonna spread to the other people. So this is the way how it's gonna be effective. So And we should be obviously because we are now start taking the vaccination, start giving the vaccination to the most vulnerable people and key workers, and and I also wanted to obviously challenge those people who are thinking that maybe this is something they wanted to kill people or they wanted to control the population of the world. How they can think of that giving vaccination, okay, when they are thinking of, okay, this vaccination has been given to the poor people, I think they wanted to get rid of that majority of population of European continent that contains the elderly people, and they are using the resources of the world. I doesn't like to say this. They deserve more than that because they have put their whole life to build up the country. Absolutely. And that country, whatever they are doing to the elderly people and providing resources, they're their right. So those people who are thinking in this way, they should have think as well that they are giving the same vaccination to the healthcare professional, those people who are the asset of the society. So there is nothing like this. So use your common sense by thinking in those ways that this is for something to kill people or to control the population of the society, to decrease the fertility. Why they have started from the most important
I think one of the reasons, I believe, is that people in lockdown have had too much time on their hands, and too many conspiracy theories have emanated from the fact that people in lockdown are bored out of their mind and they're being mischievous.
Yeah, but I agree with you in a way, but not. But still, if there is any situation, anything arises, it's a duty of every human being, whether literate or illiterate. If he knows, he has to search himself. If he don't know or he don't know something, he has to work out to find the truth, and then
That's
obviously
true,
convey the thing.
you're putting that up as a person, as an individual's personal responsibility. I think there's an equally important, if not greater, message that the government, the United Kingdom government has a responsibility to run information campaigns that tell the information as it is. And if somebody says, I want to ask you a question about, is the vaccine halal? Answer it.
Yeah.
You know, does the vaccine have alcohol? If it does, tell us.
Yeah.
There's no harm in knowing the truth, and then at least we can make an informed decision.
Yeah.
But if a vaccine doesn't have alcohol in it, isn't pork based on pork derivatives, and is halal, then tell them the message as well. Don't be afraid of saying it's halal, because I come across many people who don't want to use the word halal because it offends other people. Rubbish. If it's halal, say it's halal, and let people make their own choices. And as far as the information campaigns are concerned, I think this is part and parcel of hopefully where we're going to be going.
Yeah, and I just second to your thing, obviously that I have started from the first as well. So every campaign or every action need to be taken by anybody in any situation should be followed by on the government level. Then it's going to be effective, because this is their basic responsibility. This is not something dealt only by the foundation and the people who are volunteering. This should be done by the responsible people with their thinking of this is their responsibility. And obviously we are already working, and we can work more to spread the truth. Okay. And that's the important thing.
Yeah. Now, I've got a question for you, Andleeb, and that is, if somebody takes the vaccine, there's a question that's been spinning around in my head. When the AstraZeneca BioNTech vaccine came out, they said you take the first shot on day one, and then your body will start generating the resistance to COVID by about day 10, and then by day 21 you take the second shot, which will complete and provide additional protection against the virus. And now the government's taken the view that actually you can take the first shot of AstraZeneca and not take the second shot for up to 12 weeks later.
I think it's about Pfizer you're talking about.
I'm saying I'm confused. Perhaps you could enlighten me.
Obviously, at the moment on that thing, obviously it has been initially thought. Obviously, it was recommended that you have to take two shots, and
21 days apart.
21 days apart, in order to get the full immunity, full response. And obviously, in now in the presence of the new variant, obviously there are going to be a lot of other challenges as well. Yeah. But this is the basic thing that we need to do it. But on the basis of when they're
not doing that, are they?
No, because then there was an issue come that whether giving a small amount of immunity or some defense system to some of the 70% people. So in order to reach majority of the people, they had decided to giving the two shots to one person. Can they start first giving most of the
shot.
people with one shot.
One shot.
And then when they're gonna get, and they are trying their best to get more and more of a supply, then they start second. So there is a lot of things going on. Obviously, they're gonna inform the people as well, inform people through the media about this one, because obviously on such a bigger scale, giving vaccination is something new in the history as well. And obviously we have progress being a human in so many things from this type till the last time when it happened. So when the Spanish flu came, the people are dying on the streets and things. And you can imagine that when I have heard about the pandemics in the start, and then I was starting recalling about, obviously from the YouTube videos from different media that I have studied about the pandemics and what happens on those days. And even it was so much fear that maybe that is going to happen this time period as well. Obviously this is what happens always in the history, that the people are dying on the streets and nobody is going near to the people, and people are abandoned because you have dead bodies on the streets and in the houses, and the whole towns and area has been blocked. So that could be possible, that was possibility as well, not in my minds of all those people who are aware of the history, what happens before. But like every other thing, we have, mashallah, have such a great technology. We are doing things much more faster. We are making things much more in a faster way and in a bigger magnitude level, and bigger and doing the bigger productions, that we haven't reached that thing.
Right.
And obviously we and thank God, thanks to Allah Ta'ala, that we haven't saw that phase of history repeated, and we have got something.
Absolutely.
And this is all with the grace of Allah Ta'ala, with the help of Allah Ta'ala, who has sent the virus, and He has helped humanity in the same way to to find its cure as well.
I've got another question for you. After you've taken the vaccine, and let's say you've had your immunity built up, either on the first or the second jab, that then provides you with the ability to then go out and not be under lockdown, not be under restrictions.
No, not at all, because obviously the most prevention is better than cure is always there, and this is something that our religion told us, and
but the government said if people take the vaccine, the most vulnerable, they'll be protected, and then they can start easing lockdown. So this is where the confusion's always.
It is not going to be as much as when the people are not taking at all. So it should be understand that whenever you are introducing something, we even not, because of the variant now, we are not even sure about that, whether this vaccination is going to be quite as effective as it should be. Obviously it's going to be effective, but it's not going to be as effective as should be that when the new variant is come. So we are going to keep the same, we should have on an individual basis, going to keep these measures that we are taking at the moment in place. Wearing the mask, keeping social distance indoors, and don't go to
mixing.
Avoid the mixing. And because whenever you start taking something, it's not that it's going to be magically affecting and curing you. Everybody has a different immune system to respond.
So you're saying that the lockdown process and the protections that we have in place will continue for the foreseeable future, despite the fact that the vaccine has been taken?
Not not in that strict way that is happening now. Obviously we are still, there are different aspects of doing different things, and on the basis of the government, I'm not talking on their behalf, but being a citizen of a government, which I am always alert what they are doing, whether it is helpful or not, whether it is effective or not, and if any government is taking any action on anything that is not in the favor of a community, we should have raise our voices. So the important thing is that at the moment of time, because of the lockdown, there are a lot of things are happening as a side effect of the lockdown. We are preventing people getting virus and obviously dying, but on the other hand, there are a lot of things associated related to the domestic violence, abuse of the children, and people are economically are affecting in such a bad way. The increase of the psychological issues and the problems are going to happen. Mental well-being is it's a big issue as well. So it is all depends on how on the government level they are going to think about the situation to deal. So when there is a vaccine there, so there is at least they are providing some protection to the vulnerable people, but it's not mean that they are free to go and take off the mask, because this when you are introduce something in your body produce a response according to that, and that response build up with the passage of time. So at the moment, obviously according to the research, they were saying it is 94% effective, and how it's gonna behave in the sample groups, and how it's going to behave actually in the bigger population, and also in the presence of new variants, how it's going to be, how much it's going to be effective. Okay, it means, I'm not saying that I wanted to emphasize that obviously it is going to be something there that support our body, but just obviously thinking that they get the vaccine or they wanted to do anything what they want, no, they have. We have to see how the body, how the people in the general population going to respond to the vaccination, and for that the most important thing is to getting vaccine.
Sure.
So they
Well,
know.
I'm going to say that people are already quite tired of lockdown, quite tired of the restrictions, quite tired of not seeing their families and their loved ones, and for all the absolutely the right reasons. But I think the message with the vaccine is that magically that's now going to dissipate, and you're saying that it's not. We still have to continue with some form of restrictions, some form of mask wearing, some form of non-travel. And so
Yeah,
forth.
even because even we are not giving to 100% of all the population and everybody in this country vaccination. It just started now with the people with high risk groups, the elderly people, and then the key, and mostly the health professionals and key workers. So we should be stays vigilant and take proper measures till all the society is going to be started having all the people having the vaccination, plus then we find out, because with giving vaccination to the people, there is also research going on meanwhile how it is affecting are the people who are having vaccination getting virus in a month's time, 2 months time, or 5 months time. This is a similar way that people, obviously every virus produce herd immunity in yourself, but majority of time it's working, but in some of the people it's not working, and people who got COVID positive in the first first wave of the pandemic, they got reinfected as well.
Yes.
And that's obviously that's
And
going to
there's
be
also the complications of long COVID.
yeah, and that was quite severe, and I am going to obviously emphasize through this radio channel that children they are obviously not showing the symptoms like other people, like adults, but we are thinking that they're going to be long-term neurological and other systemic effect of the children as well. So we should be very, very careful. It's causing strokes. It is just obviously I got myself COVID, my whole family got COVID, and there are close relatives.
You had COVID?
Yeah, I had COVID
Oh,
in
right.
November.
Okay.
And
The whole family had COVID?
and then the
Oh
whole
my
family
God.
got the COVID, and that's not spread through NHS or through
No.
me working in the hospital. Obviously, there we take lots of precaution. This is another aspect of government failure, you can say, or we have to obviously raise a point when they haven't taken very strict measure regarding the schools. So my son got COVID because one of the child in her class bubble got the COVID, and he came home, he has a temperature, and from them obviously when he has contacted with other people, and step by step we get me, then he get, and then afterwards two other children, and then after he was recovering, then I got it, and we were taking care of him. Even my parents, my mother and my husband, they are in the down floor taking care of us while we had having the COVID, and we have gone through that process. But we were isolated in different areas of the house, but still after 5 days when we were recovering back, they got it. So it is very important, and I have quite near family members. This is my personal opinion, but obviously on a scientific basis as well. We have neurosurgeons and people from the neurology that have emphasized that because of the post-COVID symptoms, one of the side effects is having hypercoagulability, and that causes heart attacks and strokes.
Right.
And my sister, she got COVID, and then afterwards she had the mini stroke when she was recovered after a month. And there was very near people, quite near to the family members. Obviously, being a doctor, we know the percentage of people they are having this, and we have papers that published and things. But being a members and having some people very close to you, who was quite young, had a COVID, he recovered afterwards. And then after a week he has a stroke, and then after that that was a mini stroke, but he has a heart attack afterwards. So all the complications of having hypercoagulability and thickening of blood. No, he died, unfortunately. Yeah. And the stroke and multiple stroke has been, obviously it has been published and has been discussed quite a lot on our forums, medical forums, that is happening, and a lot of psychological effect. And I have some of the colleagues working with me, they're told that they never get back the energy. The people who lost their sense of smell and taste, some of them haven't got at all. And these are the things that we, being a human, I think COVID has changed a lot in me and bring a lot of improve and increase and sharpen my belief a lot. Because all those things that we take for granted, the taste, we never thought that if we are eat something without having a taste, how it looks. So I have spoken, because I didn't have, we didn't have, none of us has a loss of taste. But my other colleagues and friends and family members, and I have a couple of friends who got the COVID, some had got the severe one, some had the less. So she was telling me that she was eating, you know, we like being Asian people eating a sarg and different things, and we enjoy the taste of things. And she was saying that from so many days, for 2 weeks, I am eating, but I am having no taste. So it's just something is in my mouth that I'm just swallowing.
That's quite a. I can't imagine life without having,
taste and smell.
without taste and without being able to taste mirch and yeah. I mean, one of my favourite dishes is sarg, and you know, so I can't imagine what life it would be like.
Yeah,
and it's quite a long-term effect. It doesn't come back quickly, if at all. So I can't imagine what life would be like without taste.
Yeah, and you know, it's quite obviously everybody, every human being have this nature, and I have this nature very since childhood. I try to think about things very deep, and their back, their front, their future impact and things. So whenever you know, in Quran, Allah Ta'ala says in a very nice way that He has given us ears and eyes and ears for listening, hands, and he counts all those blessings that He has given, and we take as for granted. And then He mentioned that human beings and people don't thanks to Allah Ta'ala. So this was the time when practically He took the taste and the smell and lots of blessings that He has given, and then put us into realization that if He took them all, or if He should not haven't given us those for the first time, how it will be, and how it would be.
We've taken so many things that we've taken for granted. You mentioned food, but you know, I haven't seen my father for a long time because he's shielding. I haven't seen my brothers because I have 3 younger brothers, and we've been very strict about mixing. We don't mix. Yes, we do video conference calls and we do mobile calls and so forth, but it's not the same. Yeah, there's been no get together. We've had members of the family that passed away last year, and their anniversaries have come and gone. We can't give support to each other in a way that we used to, and those are simple things that we took for granted. And we're a very kind of a tactile family, so we're always hugging each other and so forth. We haven't been able to do those, and it's really left a big vacuum in just the day-to-day relationships. And you're quite right. We've taken those for granted, and we've not been grateful to those. Now that they've been taken away, I can't wait to hug my nieces and my nephews, just to show them.
Yeah.
Andleeb, I hadn't realised, but we've been talking for 1 hour and 50 minutes on this podcast, and it's been absolutely fascinating. Really enjoyed the conversation.
Yes, the same
and
thing.
you give us so much information, and you have to promise that you get your colleague, Dr. Dr. Asma, yes, to come along to the radio show, and we'll do the interview live, and we'll get that together. We'll get this podcast together. We'll take bits and pieces and put together a visual media show to give to our MPs, to give to Mr. Zahawi, and hopefully we'll get it up to Mr. Hancock and to Mr. Johnson to say, you want to get the message out to the BAME community, come and talk to us because we know how to do it.
Yeah.
You know? And I want to say from the bottom of my heart, thank you so much for giving up your valuable time and for sharing your knowledge and expertise on this podcast on behalf of the British Muslim Heritage Centre. Thank you so much.
No, most welcome. It's
and
my
I'm very,
pleasure.
very grateful.
No,
And I hope I'll see you again very, very soon.
I will try. Inshallah.